Welcome back to What's Now, right now, talking about our health, specifically breast cancer and mortality rates, why this affects Black women more than white women. Had a discussion with two individuals about this, what we need to know. Let's take a look.
Black women are more likely to die from breast cancer than white women. More progress needs to be made to improve outcomes for Black women with breast cancer. These improvements can start in the early days after diagnosis by ensuring that they have access to reliable, clear, and accurate gene expression profiling, a test that unveils biological insights about each unique tumor, especially since recent data has shown that not all genomic tests are the same or are as accurate for Black women. Joining us to discuss are Dr. Sonya Reid, Assistant Professor in the Division of Hematology Oncology at Vanderbilt University Medical Center, and Aleseia Saunders, a breast cancer survivor. Thank you both of you for being here.
Thank you for having me.
Dr. Reid, what is the current state of breast cancer rates, and why is there such a disparity in treatment and results for white and Black women?
Yeah, it's a great question. So, approximately 300,000 women will be diagnosed with breast cancer this year. And while breast cancer incidence rates among Black and white women are similar, the mortality rates are, however, very different. Black women are actually 40% more likely to die from breast cancer than white women. And we know that there are many reasons for these racial disparities in mortality, to be specific, including complex socioeconomic factors and access to care, but differences in biology also plays a role. We have seen that Black women are disproportionately affected by more aggressive breast cancers because of their tumor biology. And a recent study has actually shown us that Black women are significantly more likely to have genomically high risk tumors compared to white women, despite having very similar clinical factors such as age and size of their tumors.
Dr. Reid, can you tell us more about genomic testing?
Yes, absolutely. So there are a few genomic tests available that we use in the clinic to guide discussions around chemotherapy benefit. And what that means essentially, when a patient has hormone receptor positive breast cancer, localized hormone receptor positive breast cancer, you can use that patient's tumor essentially, where you're able to profile the tumor using up to approximately 150 genes, where we're able to accurately determine whether or not that patient have a low risk disease where they have a low risk of recurrence, or whether or not that patient have a high risk of recurrence and therefore will benefit from chemotherapy.
Aleseia, can you tell us your story of becoming a breast cancer survivor?
Absolutely. I was diagnosed when I was 33 years old, and I was actually pregnant with my first child, and I had no family history. So, with those factors, my oncologist had a genomic test called Oncotype conducted, whereas I received a score back that said I was at a higher risk for reoccurrence. And with that, he prescribed a treatment plan of chemotherapy as well as terminating my pregnancy. Um, I then opted to seek a second opinion because of that. And I met a surgeon who had just returned from a medical conference where he learned about mammoprint. And with that, my scores came back that put me at less than 10% risk for reoccurrence. So we then had a treatment plan of no chemo. And I was also able to have my oldest daughter and begin my treatment, after delivery. And when I'm doing these talks and I reflect upon it, I'm very proud to say that I advocated for myself and decided to seek a second opinion, which I then tell other women to do the same. I meet, many breast cancer patients, and I tell them to be their own biggest advocate, do the research, find out, what other resources there are. Do not hesitate to present them to your medical providers, specifically because many have not been made aware of mammoprint. So, I like to engage them with it, tell them to go on the website, find out more, and present it to their medical providers so that they together could come up with the best treatment plan to tackle their cancer. But no matter what, just ensure they are their biggest advocate for their health.
Dr. Reid, what can we do to help guard against disparities in genomic testing and breast cancer care in general?
Yeah, I think the biggest thing, Alicia said it well, advocate for yourselves. Bring a loved one, bring a family member to all medical appointments if possible to assist with those discussions, to be able to ask those hard questions and to have a very vibrant discussion about different options available. But also, we know that there needs to be, we need to make sure that genomic testing is offered to all patients that is eligible or that meets that criteria, because only then will we be able to use that information appropriately to guide treatment choices in the clinic as we have those discussions with our patients about the best treatment path. So absolutely try to advocate for yourself and advocate for genomic testing when appropriate.
And where can we go for more information?
For more information about gene expression profiling, I would say, try to go out there and get resources that can help you talk to your doctor. Agendia.com is a good place to start because you will get all the information about the test that we discussed here today.
Well, thank you so much, Dr. Reid and Aleseia, for joining us today. Aleseia, I'm so glad to hear that you're doing well and appreciate you sharing your journey. I know it'll help many people as well. And Dr. Reid, thanks for this important information about disparities, genomic testing, all these things. So appreciate your time today.
Absolutely.
Thank you for having us.